Give the call to the member for Cunningham.
Thank you, Deputy Speaker. Well, I thank the member for Macquarie for putting this issue on the debate today. It's not a new issue for me in speaking in this parliament to talk about the experiences of constituents in my area waiting for home care packages. It is a persistent issue and a persistent problem in electorates right across this country. It is indeed an issue that was raised in the interim report of the Royal Commission to which the government responded by releasing, I will acknowledge, an additional 10,000 home care packages. The problem is that's less than 10% of those that are actually on the waiting list. And when you consider the way our community is ageing, there are as many people coming onto the waiting list as the band-aid of a small percentage of new packages addresses. And so the problem we've got now is the waiting list is just not being tackled. And the repercussions of that are not just numbers and figures. They are people who are making really difficult decisions in their homes and their families. So many people are very sadly, as we've heard from other speakers, dying before they're getting the package that they were assessed as needing. And we can only imagine what that meant for those that last period of their life where they were struggling in their home, having been assessed as needing support and not being able to access it. And we know in our constituency offices what that means for the families, because that's who's picking up that work. And so I've talked to women in tears because they have to give up their job to look after an elderly relative, families torn by guilt about the fact that they can't do what their elderly relatives need, and very often people going into residential care who didn't have to do that if they got the support they need. That's a true story behind those figures, and the government really needs a serious strategy to tackle those waiting lists. I just want to use the opportunity, because I have spoken on a number of occasions about this, to report to the chamber the views of an amazing constituent of mine, an amazing advocate in the aged care sector, indeed the Senior Citizen of the Year in Wollongong for the Australia Day Awards, Val Fell. And Val recently turned 91. Happy birthday, Val. I'm not here to talk about Val's application for home care package. I'm here to read Val's words on the work she's doing to help the elderly in our community. And this is what Val has to say. Although Australians are living longer, many of them begin the waiting game as soon as they're diagnosed with an illness, such as heart complaints, stroke, physical disability, mental health problems or dementia. In the dementia field, because of the lack of face-to-face discussions with an advisor, people with dementia and their carers wait to access services because they're often unaware of their existence. There is a dementia advisory service, but the staff numbers cannot cover the number of people involved. For example, one advisor to over 6,000 people with a diagnosis in one area. Arranging an ACAT under the current system is usually without problems, and carers are confident with the result because they know that the assessors are part of a trained multidisciplinary team. And Val was making that point because of our concerns about the privatisation of that service, so I'm very pleased the government has backflipped on that today. If you are computer literate, and not all aged people are in that category, finding a provider for home help under CHSP on the My Aged Care website can be time-consuming and frustrating. Many people are initially looking for domestic assistance, personal care, gardening and transport, although there are other services listed. This means going through the process 4 times. Difficult if you're caring for someone 24/7 who's constantly shadowing you. The result of trawling through the system at the moment in many areas is with domestic assistance it's not available, but you can go on a waiting list. Personal care, only one organisation who says they're currently not available. Gardening, only available from 2 organisations on a one-off basis. And transport depends on your postcode. Val has done a lot of work advocating tirelessly for people who ring her seeking assistance She's an amazing 91-year-old, but on her behalf, as an advocate in my community who lives this day in and day out, I call on the government to take more immediate action to address this matter.
Order. I thank the member for Cunningham.